Nicole Poulin. I'm Executive Director of the Family and Children's Trust. I know several of you in the audience, and probably were watching this recording as well. I'm going to skip my usual history of fact because I think by now most of the folks participating in this opportunity are probably aware of who we are and what we do. If you have any questions about that, I would encourage you to check out our website, and you're always welcome to contact either Taylor or myself directly, and we're happy to give you more information than you ever wanted on FACT in our work. So don't hesitate if you have any questions about kind of who we are and how we operate. So I'm going to get into just very briefly, I don't want to get too far in the weeds with this, but just the history of the ad hoc grants so that folks know kind of the context of where we are and why things are the way they are with this particular grant opportunity that FACT is offering. And so historically, many of you probably know this, FACT had this pool of funding called the ad hoc grants. And those were initially really focused on supporting training, mostly like state conferences that were statewide events. And the amount of that award that folks could write in and request funding for was started when I came about 10 years ago. It was $2,000, and then it got bumped up to $3,000, and then up to $5,000. And the process for that was that programs could just write in a 1 or 2 page letter to the Board of Trustees for FACT. And when they met quarterly, they would look at the letters and decide whether or not they would provide funding for that event. And so it was a very simple process. It has been around for a long time in Virginia, and a lot of nonprofits and programs are familiar with it. And there's kind of a cohort of statewide trainings that FACT has been supporting over many years. And then we've also been doing some new things with that recently, which is really cool too. So this year, the Board of Trustees decided that they wanted to kind of take a new lens and a new look at how we're doing these ad hoc grants, because FACT was really fortunate a couple of years ago to be included in the casino bill for Virginia. And so we get a very small, 0.2% portion of the proceeds from the state casinos. And so we have a lot more money. For us, it's a lot more money than we have in the past. And so the Board of Trustees is working really hard to figure out ways to get that money out to as many programs, to support as many things as possible in a way that is still being good stewards of that public money. And so this is kind of a part of that effort. The board decided to look at these ad hoc grants and see kind of if there's any kind of tweaking we could do to make it more accessible and flexible and have a wider reach. So in that process, it's an ongoing process. So initially they allocated $300,000 for the whole fiscal year. Our fiscal year is July 1 through June 30th. And the plan was to have that money focused on supporting services that were in kind of 2 buckets. One was up to $5,000 awards for training or organizational capacity. So organizations could write to get training for their staff, also to do things like strategic planning or consultants or anything like that. That was up to $5,000. And then the other kind of bucket was up to $10,000 to support direct services, which was a pool that would have been, that is kind of similar to how FACT has supported the emergency grants the past few years, which is really focused on programs that provide direct services to individuals. And our focus is family violence across the lifespan, to provide that funding that isn't covered by other types of funding. So it's flexible funding that can do things like cover, first month's rent if there isn't any rental support in your area. It's covered stuff like diapers for people that don't have funding, utility costs. We paid for car repairs, those types of things where in your community, if there aren't any other resources available for the clients you're serving, that money could be used for that. And we also wanted to make it even more flexible than that so that programs could use that pool of money to support any direct service staff. So if you had counseling services or legal advocacy or something like that, that money could help support that. So those are the two buckets that the board intended for that $300,000 to be used for. And the initial idea was that we would have 2 rounds of funding, one in the fall and one in the spring. Well, we received for that first round of funding out of so $300,000 to the whole fiscal year. The first round of funding, we received 42 applications totaling more than $460,000 total. So that was a lot more than was allocated for the whole year. And so out of that, about 29 of those, totaling about $150,000, were for that training and community and organizational capacity grants. So those are up to $5,000 grants. The remainder, 310 approximately, was for direct services. So what the board decided to do was to fund all of the training and organizational capacity grants at $150,000, and none of the direct service staff, because we were limited in the kind of how the decision would be made around who could get funding and who didn't. And so they really felt like this was the cleanest, fairest way to do it. And so all of those lucky people got their up to $5,000 grants for their training and organizational capacity. And the programs that wanted direct support did not receive that funding. So that is the backstory. So if you are one of those agencies that did not receive direct service funding when you applied, that was why. It really didn't have anything to do with the capacity or the how well written your application was. It truly was just they were trying to do the very fairest, best thing that they could in the circumstances that we were in. And so that left $150,000 for the spring money, which is where we are today. Except given the amount of request and the circumstances of the time that we live in, they decided to increase that remaining $150,000 to up to $200,000. So those are now grants for up to $10,000 per grant to support direct services. So there's going to be 20 of those total that will be awarded. So that is kind of where we are. Does anyone have any questions about that history? And I'm sorry if this is too much information, but I want to be as comprehensive as possible because I know this is kind of a little bit complicated, and I just want to be as transparent as possible at kind of how we got here. Yep. Sarah?
Can you hear me?
Yeah.
Okay. Sometimes my computer does weird things. And you may get to this in a second. So I apologize if I'm jumping ahead. Because we did receive one of your grants previously, but we were lucky and we got the first round, so we had the whole fiscal year. But this because we are seeking direct support. So is it still the fiscal year?
Yeah, so I'll get to that.
Award?
But if you were awarded, no, don't apologize. If you were awarded this fiscal year, so we did a lot of emergency grants before July.
Oh no,
1.
this is new. So it would be a new. We haven't applied in this fiscal year. Okay, but I just didn't know, because historically when we did, we had the whole, not 365 days, but you get what I'm saying. We had from like
exactly what, yeah.
We had from like November to
you have a whole
June
year to spend it, yeah.
But this go around would be like March to June, or what's like?
I'll get to that in just a second.
Okay. I'll be quiet.
But no, good. That's a very good question, because it gets even more confusing, right? Because of the way the funding has been rolling out over the years. See, it's really difficult because we've tried so hard to be as accommodating and supportive of as many programs, and we have so many restrictions with regard to how we're allowed to allocate money because we have to use state procurement. And so it's really complicated, and trust me when I tell you, I know how administratively burdensome it is because we're 1.7 staff and we have, it feels like 500 grantees in the world. So it is really challenging. So it's, your confusion is very normal and understandable, as is mine. So let's all have grace for one another. Okay, so if nobody has any questions, does anyone have any questions about that historical part? Molly?
Sorry, not really about the historical part, but just more clarification about direct services and what that would include.
All right.
So you mentioned staffing as being eligible, but then the examples you gave were like working with partner, or like, you know, covering costs to work with partners, you know, consultants, things like that. If the client needs a service that is not offered, you know, by the agency, it sounded like that's what you were describing, but would it also be possible, would it be possible to use it for example, just like funding shortfalls, like loss of funding and trying to keep staffing levels even?
Yep.
Like, could it fill in those gaps?
Yep. Yeah.
Okay, great. All right, thank you.
So I'm going to jump into the application part now, because that's, I think, what most people really care about. So Taylor, could you please pull it up so we can talk through it? So what I'm going to do is just go through it, and then if you can hold your questions to the end, then I'll answer them all. And anything you don't get answered today, again, always feel free to reach out to us directly. We're as accessible as possible. So these are the direct service applications. So as I said, there's $200,000 available for the prevention and treatment. If you look at our, I would encourage you, if you haven't seen it, our prevention spectrum, our board of trustees, I think, has been really on point in looking at this issue from a public health perspective. And so it takes into considerations issues of primary and secondary prevention, which opens our funding up to even a wider spectrum, I think, of services than sometimes is traditionally supported, which I think is good. But it also can be confusing for folks to try and understand. So as far as eligibility, so you have to meet this criteria in order to access this application. Either a governmental agency, so local government agency. So if you're affiliated, you know, if you work for one of those, or if your program is a 501c3 nonprofit that is currently receiving direct funding from any of these state agencies. So if you have a current contract, and you'll know it if you work for a nonprofit, trust me, because you're going to have a lot of paperwork you have to do for these agencies, and you have a contract administrator that will come and do monitoring of your program and all of that jazz. So you've got to have an active contract with one of these agencies, one or more of these agencies. And that your agency's had a formal audit or review of accounts, because the board recognizes that if you have a smaller nonprofit, you're not required to have a formal audit, and they're very expensive. So as long as you've had a review of accounts in the last 3 years, you're good, or an audit. And then you have to have filed a current 990. So that means if we want to Google it, we should be able to find it on GuideStar. And if we want to request any of this stuff, then we can from you. And then this is the tricky part. That this is not tricky, but confusing. So if your agency was awarded a grant in the last round of funding, you would have found out in October, early October, if you were awarded one of those training or organizational capacity grants for up to $5,000, then you are not eligible for this particular grant opportunity. If you were awarded an emergency grant or an ad hoc grant any previous years, even if you haven't spent it all down yet, although I hope that you would spend it down before you ask for more direct services, but even if you haven't spent it down, you can apply for this funding. Does that make things more clear for folks? Okay. And then let's go down to the award information. So the way these work, if you got an emergency grant in the past, which I think many of you have, it's a first come, first serve. So basically, if you meet the minimum criteria and you come in up to $100,000 as first cohort, you're going to get awarded. And so it's first come, first serve. Your funds have to be spent within 1 year of the award notice. So that's, I think, where things get confusing, because if you're awarded, I forget the award dates we have down here. Can you go down a little bit, Taylor? Because I don't know. Let's see. So if you're awarded to on like February 27th or March 1st of this year, you have a whole year to expend those funds. You don't have to. Some folks have gotten me invoices in 2 months because they're spending it so fast, but you have that long to use it. So does that make sense? And then let's see. Okay, and then hopefully folks understand, and it's very clear that all of our funding can only be provided on a reimbursement basis. So, and you have to spend down your entire award, and then you'll submit an invoice to me and a report that's very short. We have the questions on the website. And then, and backup documentation, which is just like whatever accounting system you use. I don't need receipts. I don't want receipts anymore because I was having like 50 pages of receipts. Any backup documentation from your accounting system, like QuickBooks or whatever, that indicates the specific costs associated with this funding or where the funding went, basically, then you'll receive a hard copy check from the Department of Treasury within 30 days. Hopefully, like that's the goal, but the mail is the mail. And so that's the way the funding works. And so you have to be able to have that money to front up to provide that upfront cost, which I think most organizations are used to that, but we just have to be clear about that. And then any of the materials that you do, like if you're, advertising or doing something on social media, please recognize FACT and like us and share our support, because we're a very small organization and we're a statewide organization, and we're working really hard to let folks and legislators know who we are, to try and get more support for the work that we do on behalf of the programs and services. And so please help us do that by sharing our logo and giving us some credit for your work if we're supporting it. And so the timeline that we have is we're going to do 2 cohorts. Just so you know why, because it's kind of a little goofy for some folks, is that the board struggles really hard and is very dedicated to being as equitable as possible in connecting with programs that have different levels of capacity. And the concern was that if we just had, because it's first come, first serve, we just had one funding period, that all of the larger agencies that have like professional grant writers and have a lot of capacity to do this stuff, within like 2 days, everything would be allocated. And it wouldn't provide time for the smaller agencies that might need a little more time to work on something like this, even though the application is extremely easy. Just to maybe even become aware of it, so that there is trying to be a little more equitable to those programs, to give more time to programs that might need it to learn about this opportunity and also to be able to apply. And so that's why we're doing 2 cohorts. So the first cohort's already open, already gotten a few applications in, I haven't looked at. And then those awards will be made around, hopefully by the end of February, for services to start on March 1st. The reason we're doing it that way, we're not going to know before then, because the board is trying to be sensitive, and we appreciate this, to our administrative burden. And so we're going to be basically holding everything in a file until the end of the grant cohort, until February 13th. And then we're going to look through them and go through, and the first 10 that meet the criteria will be awarded, so that we have kind of a way of managing our workload, and also a way for us to manage the award period. So we'll have just 2 award periods instead of having a rolling process the way we have in the past, which just on our end makes things a lot more confusing. So that's kind of what the timeline's about. Please make sure, if we want to go through the questions, Taylor. This could not be any easier. So please make sure you take the time to complete the application. We're going to go ahead and say, starting today, that we're not going to, if you submit an incomplete application, then we're not going to consider it, because it's just not fair. The whole idea of this is we're doing a lot of grants. We don't have the capacity of chasing people down and saying, get me this, get me that. You have to submit a completed application. So that means when it has your agency, director's name, title, email, phone number, please put that. When it says your project administrator for your grant, please put all of that information. Don't just put their name on there, because we're not going to take it. Like, I don't mean that to be mean, but we have capacity issues that we're trying to manage on our end as well. So let's see, Taylor. So your service area, what's your approximate annual budget for your organization? And then it's just basically yes or no. Have you done an audit? If you're a nonprofit, do you get funding from one or more of these agencies? And what's the grant? And are you in good standing? So if you are an agency that has outstanding findings, or you're in the middle, please write in there if there's any of that stuff, just because we want to know about it. Because that doesn't necessarily mean you're not going to get funding. It just means that we can call your grant administrator and see kind of what the issues are. And if it's just, it just means that we want to be able to have that level of oversight. And then your information around your contract administrator for your grants. And then it's $990. How much money are you requesting? And then what direct service funding? So yes, this can be used for staff support as long as it's direct service staff. And whether that's new or existing, if you've lost funding, that's fine. If it's for additional staff support for, like I said, counseling or legal services or something like that, that's fine. And if it's for a mix of that, and or like you want to have some money available to do direct service support for clients, so if you want to be able to have a little bit of pool of money to cover things like those utilities or housing costs or anything like that, you can do that as well. Just please be mindful of, and I know this is obvious, but please don't supplant funds. So if you have a contract with DCJS and you're paying a full-time staff person with that grant, please don't submit don't change your funding from DCJS and reduce it by $10,000 to move that funding to another category and supplant it with FAC money. Don't do that. This would be like if you're losing money, then it would be appropriate to do that if it's a new position you want to support or something, but don't supplant existing grant funding that's being used for a position. And I think folks are aware of that. That's just kind of best practice, but I feel like I need to say it. So do you all have any questions about any of this? All right. Taylor, do you want to maybe just so, because we're here, pull up the questions for the final report on the website? So the final report is very easy. We really wanted to make this not burdensome for you guys at all because we know you all have a lot of administrative stuff that you have to do. So we just want to know like how many folks, we say we should modify these because this is really participated. How many people did you serve with this, or were you able to serve? And then what impact did it have on the activity? We need to change. These are really focused on the training and organizational capacity stuff. But basically, we want to know like how did your organization benefit from this? And then if you have existing evaluation summaries, so a lot of you are getting, if you're getting those other grants, then you have like VA data collection or other types of existing evaluation stuff. If this money supported any of that, please let us know. And really what we'd like to hear, what the board really appreciates hearing, is any stories you have about how this money was helpful. Do make sure that you withhold any personally identifying information on clients. I'm like a little bit surprised with some of the reports and stuff I'm getting from folks where they have like the full client name for everything on invoices and stuff. Please be mindful of that and don't use any personally identifying information. But if you can, if it's appropriate, please share with us like an example of how this money helped some of your clients, because that's really the information that the board is really valuable to the board. So yeah, does anyone have any questions about anything? Taylor, did we get any questions sent in ahead of time?
We did, but I believe that they've all been touched on already. Talking about kind of like, what is the eligibility if you've had a previous grant, which you covered, the focus area of it being direct services and what that kind of means. And then if new nonprofit organizations are eligible, which if they meet that criteria that we've listed out, then they would be.
Patty, do you have a question?
Yes, actually, I have two. The first one has to do with we've received this funding in the past, but it wasn't on a reimbursement basis. We just were awarded $5,000. So what I'm hearing is this one is different. This one is going to be a reimbursement. So we pay it up front and then submit invoices to you, correct?
Yeah, no, you haven't gotten any money in the last 10 years that wasn't reimbursed from us.
Okay.
Because I only am releasing, I mean, we're only permitted by law to release funding once there's an invoice submitted. The only way I can pay you is you submit an invoice to me for expenses, and I send that to Department of Treasury.
Okay,
So,
I must have gotten that money from a different place then. Okay.
yeah.
So here's my second question. When we're talking about doing staff support, when we talk about loss of funding, we have a grant that we applied for and we're supposed to be awarded last fall, and it's been delayed and we haven't received any notification about whether or not we've got it. I guess what I wanted to find out is could we apply for staff support for this person who is currently unfunded? What would happen if, say, in 30 or 60 days or something like that, we do get notification that we are going to get that grant, but they don't backdate it? How does that impact if we were to apply for this one?
So I would say with that, you would call me and we would need to work it out. I mean, I think it's appropriate for you to apply to cover that position and just write in there the situation. And then, I would suggest that in that particular situation, I would ask things like, are you able to modify with whoever the funder is, the award that they are providing to have it cover another staff, can you modify on their end, or, you know what I mean? So we can work that out, but that would be appropriate, I think, given the time. I know that There's so much uncertainty right now for programs. I know what's happening at the federal level, and also where GA hasn't even started, so we have no idea what's going to happen. So, I mean, we will be as flexible as we can with you. I can promise you that the board's intent is to be as flexible and as accommodating as we can be. So, we can work things like that out, I think.
Okay. Thank you.
Sure. All right. Any other questions, folks?
Oh,
Okay,
I have
well-
another question.
Yeah.
Oh, thank you. Is it possible for multiple programs within an agency to apply for the grant? I'm thinking, you know, we have one program, our CHIP program is definitely a good fit for this, but I was thinking of another one of our programs that you know, could also benefit from these funds. Is that possible, or do you just look at the agency level?
Yeah, we're only going to be awarding one grant per agency.
Okay, thank you.
If you wanted as an agency to say with that $10,000, we're going to do 5,000 for this program or 5,000 for this program, you could do that.
Gotcha. Thank you. Yeah.
Yeah. All right. Any other last call, folks? Well, all right. Feel free, like I said, to reach out. Thank you all so much for all the work you do. I know these are challenging times for everybody, and we really appreciate. Oh, Rob, did you have a question?
Yes, just a quick one.
Sure.
If we're looking at potentially starting a new program, a new outreach, I guess really is the right way to explain this. We're not really adding staff, but we would probably need some training. Is that something that would be covered?
So not in this particular opportunity. This is really focused on that direct service support for folks that you're serving, not training or organizational capacity for your staff.
You answered my question.
Oh, and I would encourage everyone just to stay tuned, because I suspect that, you know, this is an ongoing process for our board, that they will be reevaluating at the end of this fiscal year, kind of what they want to do with this pool of funding. And so I would be strongly suspect that there will be even more changes next fiscal year to this. So stay tuned. And if you're not on our listserv, please get on it, check our website, and like us on social media. We're trying so hard to be like in the 21st century. So, any last questions? Thank you all so much for being here. And let us know if you have any questions or there's anything we can do to help. So, everyone have a good one. Thanks.
Thank you.